Hey guys, a quick review of what we did today for week one. Do know that temperature above 99.5, and definitely because definitions vary, more than 101 degrees Fahrenheit is fever. Do know that normal pulse is between 60 and 100 beats per minute. Normal blood pressure is 130 over 80. Normal respiratory rate between 12 and 16. Do know that patients present with their pain, which are symptoms. And what you see, what I see as a healthcare practitioner are the signs. Do know that etiology, logi, the study of, is etiology stands for study of causes. Understand that inflammation is a response of your body or your cells to any sort of an injury. If it's a body at the level, if it's a response at the level of the body, it's called systemic. If it's a response at the level of cells, it's cellular inflammation. Every single inflammation presents with these 5 signs. These are classic signs. Not all of them manifest at the same level. Some may have more or less of these, but all of them will be, you can see all of them. So loss of function, pain, redness, heat, and swelling. Redness, heat, and swelling is very easy to remember because they are all due to the fact that the blood vessels are increased in size and become more leaky due to a chemical called histamine. Histamine is produced by the mast cells in especially acute inflammation, and what happens is that arteriolar dilatation results in all of that liquid, namely liquid uh, coming out of the blood vessels. That liquid, we call it exudate or transudate, depending on the amount of protein. When that liquid contains a lot of protein, we call it exudate. And when it contains pus, we call it purulent exudate. Pus is nothing but neutrophils that have just phagocytosed, eaten up the bacteria. And when neutrophils are increased, they will die in increased numbers. After they have phagocytosed bacteria, we call that pus. Neutrophilia is an increase of neutrophils. Neutrophils make up about 60% of all the white blood cells, leukocyte cells. So you would understand very easily that leukocytosis simply means an elevation of the WBCs, and obviously because neutrophils are increased, which make up the most of white blood cells, the total white blood cell count is also increased. These white blood cells move taxis toward a chemical, in this case histamine, and we call it chemotaxis, toward the site of the injury. And that's where histamine acts, because histamine wants more histamine is released by the cells because the purpose is to dilate these blood vessels so that more blood flows to the site of injury and helps the recovery process kick in. General principles: atrophy, hyperplasia, metaplasia, etc. are the terms. Stricture, fistula, hypertrophy. Atrophy is an adaptation at a cellular level, for example, due to decreased nutrition, disuse, hormones, etc. For example, if someone wears a cast, muscle cells will atrophy due to bone fracture because you don't use your muscles. Use it or lose it, disuse. Hyperplasia is increase in number. I showed you the picture. You do know that hyperplasia of the prostate, BPH, is very, very common. What is not commonly known is that the keloid scar, which is a severely disfiguring scar due to a mini injury, just like piercing in a predisposed population, is actually a hyperplasia of cells that cause scarring, fibroblasts. And so those scars grow outside of the further out into the skin, way beyond the injury site. Metaplasia is seen in diseases such as gastroesophageal reflux disease, GERD, where an irritation due to acid backing up into the esophagus from the stomach results in esophageal cells changing their identity and becoming intestinal cells that look different from the cells of the esophagus that they should be. They actually become columnar cells found in the intestines. Do know that a stricture means narrowing, and a narrowing in esophagus, for example, would obviously cause a difficulty swallowing. And know the term fistula. Fistula is an abnormal connection between two pipes, two structures, two pipes. For example, one vessel, second vessel. If there is a fistula, there is a connection between. Not good. Apoptosis is a programmed cell death. It can happen in, it usually happens to help us do better. For example, in pregnancy, when there is no pregnancy, not every month, women usually don't get pregnant every month. And so progesterone required for gestation, required for pregnancy, is not produced, it's decreased. And so endometrial lining of the uterus dies, and that's programmed, and then we see it every month as menstruation. Do know that the difference between hypoxia and ischemia. Hypoxia is lack of oxygen in the tissues, but all of these hypoxia, chemical injury, infections can cause cellular injury, just like they can harm us. I mean, it's understandable that chemicals can harm us, but we are made up of cells, so it's a generic harm done to cells. These cells that are harmed may die by an accidental death, that is the necrosis. Ischemia is a term that may cause necrosis, and it's a term where blood does not flow to where it's going due to a restraint, ischemia, decreased blood flow. I showed a picture, the picture of eschar. Eschar is a necrotic tissue, not a normal scab, for example, due to pressure air. And so it looks black, brown, or tan, and it's a crusty, scab-like dead tissue, but it's also seen with bacterial infection with anthrax. Gangrene is dead and decomposed body tissue, a very sad sight. Feet are often affected. Diabetics, often severe uncontrolled diabetes, may result in gangrene, especially of their feet. Obviously, if the tissue is dead and decomposed and the patient is alive, you want to clean and remove that necrotic tissue. And the process of cleaning that wound is called debridement. Neoplasia is something that you need to know. It's an abnormal and excessive tissue growth. We also know it as cancer. This tissue growth is obviously uncontrolled, and tumors may be localized or spread. Neoplasia that may have different presentations. Sometimes cells in neoplasia look like they should. Sometimes you can barely understand what that cell looks like. It could be pretty much anything. This is a well differentiated cell, hypothetical. This is a poorly differentiated cell. A well differentiated cell looks like it should, so it's most of the time benign. A poorly differentiated cell has a greater likelihood of metastasizing and is most usually obviously more severe form of cancer. Proliferation of cancerous cells of blood, the white blood cells, is called leukemia. Emia is blood, leukos is white, and don't confuse it with leukocytosis in the tissues. Chemotaxis due to histamine. All right, trisomy. Trisomy means three bodies. Somy, three bodies. Trisomy 21 is what we see in Down syndrome, which presents with multiple signs, intellectual disability and others. There are two types of autosomal genetic abnormalities. One is dominant, one is recessive. Autosomal means not the X chromosome and not the Y chromosomes, but all other chromosomes, alleles are affected, okay? All other chromosomes are affected. X and Y are okay. So they're passed from mom to daughter or son. They're passed from dad to daughter or son. It doesn't really matter. The sex of the individual doesn't matter. Autosomal, all right? So one parent is enough for passing on the disease in case of autosomal dominant. Both parents must have not the disease really, but must have those a diseased allele. Both parents, okay? So an example of autosomal dominant disease is Huntington's chorea. I told you chorea means a dance. Huntington is the guy who described the disease first. Um, Tay-Sachs disease is a rare disease affecting kids, presenting with early death, and that's due to nerve cell destruction resulting in developmental abnormalities. But cystic fibrosis is a rather common disease that is a multi-organ disease, but most obvious in lungs, resulting in increased infections with bacterium such as Pseudomonas. And what you need to do to those little kids is physiotherapy. You need to percuss. You need to vigorously pat them on their backs to eject that dry mucus, which blocks the respiratory passages because it's way too thick and so can't really be removed by cuffing. A little baby and even adults who live into their adulthood can't really cuff that sputum. It's horrible. So we can have genetic damage. We can also have accidental damage. For example, if someone has a cut, we can repair the tissue, the skin, by just closely reapproximating, bringing those two edges of the injury, of the wound, close to each other and suturing it. Similar, so there are three ways of wound healing. One is primary, one is secondary, and the third one is tertiary. Primary and secondary. Primary is obviously where you just closely reapproximate the wound edges, and tertiary are very closely related. Primary intention that is delayed is essentially your tertiary um, intention, and sometimes you leave a surgical drain in there to plan ahead. So wound dehiscence is when a primary intention was done and the wound edges separate. The wound edges separate, and obviously you need to look at what the cause is and take care of the patient um, in the required way. Secondary intention is due to an extensive tissue loss where approximation is just not possible. And so because of that large gaping wound, you essentially have an increased